And leaders are putting partisan politics aside at this time. Premier Doug Ford today praising Prime Minister Justin Trudeau's federal rescue package.
We're very pleased to see the federal government stepping up in a big way. My ministers and I have been in constant contact with our federal partners. These EI reforms, doubling the GST rebate, increasing the child care tax credit, providing relief to seniors. These new emergency programs will help families and workers.
Doug Ford says he also agrees with the decision to close the U.S.-Canada border to non-essential travel, but stresses the supply chain has to be maintained. The Premier will now be offering daily updates to Ontarians, and we learned today he's been speaking to large retailers about social distancing and the possibility of limiting customers in stores. He'll also be speaking with the Retail Council tomorrow.
I still can't get my head around this toilet paper situation. Neither can the tissue companies. I've talked to Robert Irving from Irving Tissue off the 400 there. He said he has plenty supply. He has plenty of pulp. And for all the years he's been in the business, and all the retailers I've talked to just can't figure this out. So, and I think another discussion we should have, do we limit certain buys? You know how they have a sale, you can only buy two? Well, maybe I think we should start doing that with healthcare items.
Now we know testing is critical in fighting COVID-19. The good news is we're testing more people because of the new assessment centers, about 2,000 a day. And the Ford government hopes to increase that to 5,000 a day. But there's a backlog in lab results. Right now, there are more than 36 people under investigation. That's twice as many as yesterday. And it can take 4 days for them to get their results. The health minister says they're working on it.
We're very aware of the need to increase our capacity for testing, and we're working on that diligently right now.
You said 4 days is not acceptable. What is the acceptable guideline for lab results to come back? What are you hoping to achieve, and how long is it going to take you to be able to achieve that goal?
I can't give you exact statements, but I can tell you 4 days is too long. Certainly with 24 to 48 hours is what we are certainly aiming for. That is what we would all like to see. We are in a rapidly evolving time.
Another key concern is, will there be enough ventilators for the critically ill? We've already seen a massive shortage in Italy. I asked the health minister about that as well. She says 300 new ventilators have just arrived. And the government has been in talks with auto manufacturers looking to retool and help produce ventilators. Minister Elliott also said they are seeing more young people testing positive.
They seem to be more carriers and transmitting it to other people, although we are now seeing scenarios where young people who are in their 30s are now becoming very ill and are having to be placed on ventilators. So this is a very, very serious health situation for all Ontarians right now.
So far in Ontario, only 2 people have had to be put on ventilators. Both were weaned off them as they recovered. And one more note to tell you about. The province's telehealth line has been experiencing technical issues for much of today. The government is working to resolve them. People with symptoms are being asked to call their local public health unit instead. They want to make sure that people call before going to a hospital if they're really sick. So health workers will be notified in advance to take more protective measures.